Hello, folks. This is Dr. Paul. Thank you very much for tuning to my channel today. Today, I want to talk about chlamydia among college students. Hardly a day goes by without seeing someone with chlamydia. And I want to talk about this, especially among college students. This is becoming a very common infection, and I wanted to give my thoughts about how to identify this infection and diagnose it and treat it. So, Chlamydia trachomatis, immunotypes D2K, are isolated in about 50% of cases of non-gonococcal urethritis and cervicitis. So gonococcus can cause urethritis and cervicitis. Ureaplasma ureolyticum and Mycoplasma genitalium can cause these infections. And then, most commonly, chlamydia trachomatis. So it's almost like if it's not gonorrhea, it should be chlamydia. That is the reason we treat these infections together. If someone comes to me with chlamydia, I always treat them for gonorrhea too. If someone comes with gonorrhea, I treat them with chlamydia also, because they infect people together. They are like friends. So this one friend brings the another friend. So treat it. Occasionally, it can cause epididymitis, proctitis, or prostatitis. So chlamydia are a leading cause of infertility also. A lot of women are now suffering with infertility because they had chlamydia many years ago that they never took care of. And now, symptoms and signs. Many people will have urethral or cervical discharge due to chlamydia trachomatis, and they may have pain. They may have purulent or watery discharge. But you say they may not have any of those symptoms. I have seen tons of people who are asymptomatic yet positive for chlamydia. So don't be fooled by symptoms. You could be asymptomatic and be positive for chlamydia. Now, what are the signs? They may have cervicitis, salpingitis, pelvic inflammatory disease. They may have infertility, even ectopic pregnancy. So, in normal pregnancy, the pregnancy happens in the uterus, but in ectopic pregnancy, it can happen in the fallopian tube or ovum or even abdominal cavity. Now, laboratory diagnosis, many times when I see signs and symptoms, I tell them to get tested. Testing is simple. We can take a small swab from the penis or vagina. You can also do urine testing. All you have to do is to pee in a cup, and we send that urine to the lab. And there is a FDA approved, highly sensitive nucleic acid amplification test available now. So nucleic acid amplification testing is the best because it gives you accurate diagnosis. If you're positive, you're positive. Get treated. If you're negative, you are negative. And so always get tested whenever there is a suspicion. If your partner is positive, I recommend testing and treatment. And also screening. I advise active screening for chlamydial infection in almost all pregnant women, all sexually active women 25 years of age and under, because they have more to suffer from chlamydia. And older women with risk factors for sexually transmitted disease should also get tested. Men with risk factors for sexually transmitted disease, such as HIV positive men, or men who have sex with men, and or people with multiple sexual partners, they should get screened for chlamydia, like even before you start your relationship. Recommended treatments are like 1 gram dose of azithromycin, that is preferred and safe in pregnancy. 100 milligrams of doxycycline orally for 7 days. Remember, doxycycline is contraindicated in pregnancy. You can also use 100 milligrams of levofloxacin once daily for 7 days. Levofloxacin also contraindicated in pregnancy. So, presumptively administered therapy still may be indicated for some patients, such as for an individual with a gonococcal infection in whom no chlamydial testing was performed, or a test other than a nucleic acid amplification test was used to exclude the diagnosis. So, if there is a suspicion, I recommend treating both chlamydia and gonorrhea together to achieve the best results. And you always tell the patient, please tell your partner that you are positive and get treatment for both of you. Both of you should be treated, because if this person is treated and his partner is not treated, then he will get it back from his partner, or this guy will give to the partner. So we need to tell them stay away during the treatment, no sexual contact during the treatment, and treat both individuals should be treated. So those are the important things when you talk about chlamydia, and it's very common among college students. That's why I recommend chlamydia testing. You are welcome to visit our clinic, and we would be happy to test you, because it's a very simple treatment. A simple antibiotic will cure you and give you lot of relief from the pain and discharge and other complications that might happen in the future. And if you have any questions, please leave in the comment section and subscribe to our channel. If you have any medical questions, feel free to ask, and I will give my a physician opinion on these things. Thank you. Have a good day.